So a lot of patients do come to me and they usually apologize that they've already looked up information online, like that's something that would offend me. But the reality is I enjoy it when patients are doing their own health research. I don't have a problem with that. I just try to work with them in the information that they have. And usually I start out that conversation saying, well, what do you think you have? And I do that because I don't want them walking out of that office still having concerns if, unnecessarily. So we just go down the list of their concerns and we say, well, you don't have this because of this, but you might have this because of that. I've had many instances where they've brought me ideas that are things that maybe I hadn't thought of, and so it's been very useful for me. I just tell them to rely on good, useful information. When you Google your health information, Google has done a decent job of prioritizing legitimate websites at the very top, and they actually have curated information that pops up now on the right-hand side of your screen that's been verified. Just make sure that when you click on a link that it's going to a legitimate hospital or health system that you're familiar with. WebMD, Mayo Clinic are good sites that have been curated very well. I like to use the Mayo Clinic health information because it's something that people can relate to and they recognize that name, but there are other good resources out there. There's also National Society information that you can find, and you can look up information on their websites as well. Even on the Meritas Health webpage and the North Kansas City Hospital web pages, there is health information that's local to this area as well. As with all information, you need to take what you find and bring it to your physician so that way they can help you interpret that data and see, does it apply to you? You have to remember that health information was written for thousands of people, tens of thousands of people, and you're one individual. And so my job as a health care provider is to help narrow that information down and see if it's right and it applies to you and your specific condition.